Every 42 seconds, someone is arrested for cannabis.
Stop arresting patients! Stop arresting patients! Stop arresting patients!
Welcome to CMMNJ TV.
Every 42 seconds, someone is arrested for marijuana.
I'm Ken Walski, Executive Director of the Coalition for Medical Marijuana New Jersey. The mission of our organization is to educate the public about the benefits of marijuana. Marijuana is a safe, effective, and inexpensive therapeutic agent for a wide variety of diseases, symptoms, and conditions. No patient should suffer needlessly without it, and no patient should ever go to jail for following the advice of a doctor. Join us and learn more about the exciting science of medical marijuana. Welcome to CMMNJ TV. I'm Ken Walski, Executive Director of the Coalition for Medical Marijuana New Jersey. I'm here in the Princeton Community TV studios today with Tony Liberte from Sicklerville, New Jersey. Thank you for coming to Princeton today, Tony.
Thank you for having me. It's a pleasure.
So, Tony, now you're a medical marijuana patient and in New Jersey, and your problem initially started off with migraines, is that correct? Or tell me how your problem started, Tony.
It was originally a neck injury. I had several herniated discs, and over the years the pain got worse and worse, and then the muscle spasms started getting to be where they locked down on my neck, kind of, and that eventually created migraines. And then over the years with different medical treatments and whatnot, the migraines turned into chronic daily migraines. And
So tell me about these migraines. How did they affect you?
At first it was just I had to go home and lay in bed and, dark room, no sound, no light. I would vomit. They would get very awful, level 10 pain by far. And it wasn't too interrupting in life because it was just one here and one there, a couple a year. But eventually they became every other day, every day, 2 hours a day, 5 hours a day, 12 hours a day.
5 hours a day, 12 hours a day?
I had one that was 35 days long once. I had to go into Jefferson Hospital and actually be induced into a coma.
Oh my, yeah. Yeah, that's one of the problems we face here in New Jersey with people who minimize the significance of headaches. They kind of laugh about using marijuana for headaches, but they don't really realize how debilitating these migraine headaches can be.
I don't think anyone imagines how absolutely life-shattering they can be until you've actually had something that's that. I mean, it's like a gunshot, in my opinion.
It certainly can be a totally disabling condition.
Absolutely.
As you mentioned, you actually had to go to Jefferson. How long were you in Jefferson?
Like 2 weeks almost.
2 weeks. My. So, and of course they tried various medicines on you while you were in Jeff, and I'm sure you were trying medicine. What kind of medicines did they have you on? Do you remember?
I've used Imitrex, Maxalt. Those are migraine abortive drugs. I've been given antidepressants because being in that kind of chronic pain makes you depressed and miserable. I had a lot of bad side effects with those. I just did not like them. I was not a depressed person. I was just in a lot of pain. And of course, opiates. That was a kind of constant. With that kind of level pain, there's really nothing more that you can do. It's at a certain point.
Right.
I had allergies. I had compazine gave me dystonia. My jaw locked, and I swallowed my tongue or bit my tongue. That was actually in the hospital at Jefferson. That was. I've tried everything. I literally did use every kind of pharmaceutical drug and regimen that the medical professionals could offer.
And how long did this persist? From you had a neck injury, and then you wound up at Jefferson on a number of medicines. Over what period of time was this, Tony?
From original injury to getting on the cannabis program was 10 years. It's been about 13 years now.
10 years.
And it got progressively worse and worse and worse and worse over the years.
And so then you tried cannabis. Do you use cannabis to abort the migraines or to prevent the migraines?
Now it's more of a preventative measure. When I originally was able to get on the program, I didn't really know exactly how to use the cannabis properly for a migraine situation. So I was just smoking a little or vaping a little, and it did work as far as pain and mood. General life got a little bit better, but it did not stop the migraine cycle at all. What really worked is when I got the high CBD strains. I had the access from the dispensary for the high CBD strains, and I started making them into an oil, or like a coconut oil that I could then make into edibles. And when I was able to use a daily high CBD edible dose, that's when I've actually finally broke the migraines, and have over the last 6 months now progressively gotten better and better and better.
Well, that's very interesting. Yeah, because I've heard other migraine sufferers say that when if they smoke marijuana during a migraine, it actually makes it worse for them.
That is sometimes because it raises your blood pressure, and a lot of times migraines have a lot to do with the blood pressure in your brain. So,
or that they feel just feel it even more intensely somehow.
Yeah, if I was actively in a migraine, I would not want to go and smoke like a sativa or anything that's alert and awake like that. It certainly is not the right answer, which is why people need to learn about the different techniques and different ways.
The different cannabinoid contents, the THC content versus the CBD content, and the various forms that marijuana is available in, the flower form versus the edible forms. Now, it's been kind of difficult to access the edible forms from the alternative treatment centers here in New Jersey. So you've been making your own, Tony?
Yes, I do. I get the flowers from the dispensaries, with the different THC and CBD strains, and then I use my magic butter machine, and I usually make coconut oil or like an organic olive oil, and then those are kind of which you make in the magic butter machine, and then those are the bases that I then can either just eat the oils directly, turn them into a topical like a hand lotion or a chapstick, or brownies, Rice Krispie treats, anything like that. It's just once you have that oil sitting at home, it's that much easier to be able to dose daily and repeatedly, and you kind of learn what your consistent dose is to make you feel right.
And there's not much of a psychoactive effect, I take it from this. If it's a predominantly CBD strain, if the THC is the psychoactive ingredient,
it depends on exactly how you make it. You can make a more euphoric oil, or you can make an oil that's not going to get you high much at all. And the CBD does offset the THC content, which both allows you to put more THC into your body without the negative side effects, which not everyone thinks is a negative side effect. But
right. It's the THC is also responsible for the euphoria.
Correct.
The effect that many people seek when they use marijuana.
Especially if you're in a depression situation or a pain situation, it certainly is something that some people will want, some people won't.
Right. It's hard to be depressed when you're euphoric at the same time.
Yeah, I think that's the meaning of the word.
Yeah. So now this magic butter machine, this makes it easier to make the oils that you use.
Oh, absolutely. It's a small professional immersion blender is what I think it really is, but it's essentially put the cannabis in, put the oil in, close the top down, and press a button. It's pretty much that simple.
Yeah, that's great. And you were saying that you actually help other people to make it using your magical butter machine?
Yes, I have. If they have their own medical card and they go to the dispensary and get whatever strains that are the ones that they prefer to use.
Right.
There has been times that I've been able to use my magical butter machine to help them out.
That's great. That's great, Tony. It's very nice to hear. And so you've when was the last time you had a migraine?
Wow, it's crazy that I have to think about it.
Yeah, well, that's great.
It's probably been about 2 months.
2 months.
2 months now, and I've had May 16th is kind of like when the migraines really broke, and I think I've had 4 since then. So for 4 migraines in about 6 months, from 6 in a week before that, it's been a miracle, really.
A miracle. We hear that often. But you have other chronic pain in addition to that?
Ever since that, on May 16th, I had a massive muscle spasm that actually cracked my neck, and it felt like a lightning bolt went through my body is the only way I can describe it. It was like an electrical shock, really. And while it broke the migraines, it seems to have created, and I don't know the right word here, but it's kind of like fibromyalgia maybe, or chronic regional pain syndrome possibly. That's not diagnosed at all, but it feels like my hands are dipped in fire sometimes. Like they're icy and sweaty kind of, but they'll literally feel like they're burning. It's the only way I can describe it. It's not every day, but the one doctor that talked about it said that he felt that the main trunk nerve in my neck, which I had nerve entrapment, I guess, and they said that the nerve kind of like got wrung like a harp string.
Right.
And apparently that did something to my nervous system or my nerves that it's gotten better and better and better since that's happened. It was really bad in the beginning. And it seems with the high CBD cannabis edibles, it seems to be keeping it under control. But I mean, it's something I can feel right now though.
Yeah. Yeah, some of those radiculopathies never leave and start with nerve compression, as you said, at various parts of the body, but it doesn't affect your lower body, just the upper body.
No, my feet.
Yeah.
The feet get the same as the hands with the clammy and the fire feeling.
Yeah, I would expect that.
And it does kind of rove even sometimes. Sometimes it kind of wanders. Like my right arm will go completely numb sometimes. There's all kinds of weird little idiosyncrasies to it. And it's never been properly diagnosed, really. It's new. And
what was the original neck injury?
I fell off a ladder. Was doing some housework for a friend, and I landed like on my left ear and shoulder, and herniated several discs.
Oh, I'm sorry.
That's all good. It happens.
So now, when you went to the Department of Health to get your ID card, your medicinal marijuana program ID card, were there any issues with that? Did you first you had to find a doctor who was in the program? Obviously, not many doctors are in the program, so you had to go to an additional doctor in addition to the ones you were seeing to start this process. Correct?
Well, actually, I was actually lucky. My primary care doctor was in the program.
Oh, how about that?
So
you have a 1% chance of that happening in New Jersey.
I am a very lucky person that is how that happened. And I was like in the dark in migraines at the time when he decided that, he had gotten on the program and said, I really think that with your case and the muscle spasms and the migraines and, how you're doing and how bad you are and you've tried all these other medicines, he felt that I should get onto the cannabis program. And I believe he saved my life, really.
Well, about that. So it wasn't something you even sought out. It was something that was recommended to you.
It really was.
By your physician. That's pretty remarkable in New Jersey for that to happen.
I think I'm the only one that tells that story that way.
Yeah. And so then it wasn't much of an issue. He gave you the reference number, and then you just uploaded the documents to the Department of Health.
Well, believe it or not, I still had to go to 4 additional appointments and pay cash because the insurance won't cover it.
With the very doctor that you were seeing.
Even because I was even as his primary care patient, I was not allowed to go through the office that he worked for. He had to go to a separate office and work out of a separate office.
Oh my.
Because of issues with the corporation, I guess. I don't know all the details there.
Yeah. How about that?
So I still had to jump through some hoops. But,
I would have thought that having known you and having done complete history and physical and assessments on you and treatment care plans, that certainly could have been carried off even in one visit, even if you had to go to a different office.
And it probably could have and should have, but at the time, and this was earlier in the program, I think everyone was so nervous.
Yeah.
And it was like, we're going to do everything exactly the way they recommend it. We're not going to mess around with it.
Right. There was a great deal of uncertainty, and some physicians thought it was required.
And that's why I feel that was the situation.
Right. Right. So at any rate, you had to pay cash for these visits, and then you uploaded your documents to the Department of Health, and you got your ID card for $200.
$20.
Oh, you're low income. Okay. And so now the problem is the marijuana that you and which alternative treatment centers do you use, Tony?
Egg Harbor and Belmar, both about even. I live right in between the two. So, but it is very expensive. Even with the low income discount and using, if they have a strain that is on sale or whatnot, it still adds up, especially for someone that's on disability. It's kind of aggravating, really. You've got a medical only program here in New Jersey, and you've got disabled people that are very sick, and they're trying to get off of opiates, especially.
Right.
And you're making it as expensive and as difficult as possible for these people that are really trying to do the right thing for their own health and, anything to try and help the opiate epidemic right now. I can't see why they would stand in people's way for that.
Right. But the now do do both of the alternative treatment centers offer low-income discounts? My understanding of what the Department of Health put out was that the average cost of an ounce of marijuana in New Jersey was about $489 an ounce. So now, if oftentimes you may require 2 ounces a month, that's the limit that you can get. That's almost $900, or over $900, almost $1,000 really. So this seems like it would place it out of the range of someone on a low income to be able to afford that. It seems like it's very difficult to afford that. Isn't that correct, Tony?
It is absolutely correct, and it is not easy to both survive as an individual and buy your medicine every single month, especially on a disability check. I mean, the 2 ounces of cannabis that you need, especially to make edibles and oils, you need to have a decent amount to work with.
Sure.
That takes up my whole entire disability check.
Wow. Sorry to hear that. And do both of the alternative treatment centers offer discounts? I know Belmar does, because I took a tour of Belmar.
Yeah, I can't speak for all alternative treatment centers, but both the Egg Harbor, CCF, and Belmar, they offer, I forget if it's 15% or 20%. And I don't know if that's on every strain all the time or not, but I think that, and if I was to go get an ounce there, I think it's like $380 for myself, where it's $480 for most everyone else. Not 100% sure on that number, but it's a little cheaper.
$380. So, okay, well, that's fairly significant discount, $380.
Yeah, it's at least $100 off, I would say.
Of course, then you still have to pay 7% sales tax on
Correct.
that. That's kind of an insult to patients. It's the only medicine in New Jersey that's taxed.
Yep, taxing my suffering.
Yeah, as it were. And but now you said that you also found that your use of marijuana helped to wean you off of opiates, the opiates that you were on. Would you consider yourself being addicted to those opiates that were prescribed to you?
Well, I think the right term is dependent. But yes, I was absolutely, and still currently am dependent on opiates. With the chronic migraines, the doctors really, after going through just about every pharmaceutical cocktail that they could work up, we found that oxycodone was the only drug that allowed me to live. I really wasn't living, I was laying in bed most of the time, and it was kind of an awful existence. But once I was able to break the migraines and continuously have the safe access to the CBD strains, I've been able to slowly now, over like the last 6 months, I've weaned down from a very high oxycodone dose to almost nothing now. I'm as low of a dose as I've been in a dozen years, actually. And I'm hoping to pull the Band-Aid off here and be absolutely done with all pharmaceutical drugs in the next month or two. We're right about there. It's not quite yet, but
yeah, that's terrific. Now, and you say that you testified, you submitted testimony to the medicinal marijuana panel that the Department of Health established in support of the petition to recognize opiate use disorder as a qualifying condition for marijuana therapy in New Jersey. So that's great, Tony. I was very pleased to hear that.
I was glad that it was able to be useful and accepted in there, and hopefully we'll get something done with that.
Yeah, hopefully the Department of Health accepted these petitions during the month of August in 2016. So in September and October they will be considering these petitions, and in November, that would be next month, we expect to have public hearings about these petitions. Now, and you had your physician also submit a testimony in support of this?
Yeah, I believe he wrote like 3 pages that went into it.
Oh, that's great.
And as far as I know, it was all accepted in.
And are you going to be available to testify at the public
Absolutely.
hearings?
If they give us the opportunity, I'll certainly come and speak.
Yeah, that's great. That's great, Tony. It's so important to hear stories, personal stories. Some people dismiss them as anecdotal evidence, but the reality is that when you have someone who has a real life experience and they're telling the intimate details of their suffering and how marijuana helped them, they can't be dismissed like that. And so as mere anecdotes, because they are living human beings. waiving their medical confidentiality and telling their stories, and that really is very persuasive testimony, and that's really how we got the original medical marijuana bill passed into law in 2010. So
which has got me to be able to come here and talk to you today, because without it, if we didn't get that done in 2010, I don't know that I'd still be standing here today.
Right. Well, we have the many patients who spoke up about that to thank. Many patients in New Jersey,
Absolutely.
part of the Coalition for Medical Marijuana in New Jersey, and among other organizations too. We certainly don't want to take sole credit for it. The Drug Policy Alliance was very active. Normal New Jersey was very active. Marijuana Policy Project was active in support, and they continue their efforts for marijuana reform in New Jersey. So, so what's next for you? Are you supporting the drive for legalization of marijuana in New Jersey?
Absolutely. I think that's the only way to have all patients be able to get the access that they need. And recreational is a tough word for me, but I think that everyone should be able to grow a plant in their backyard. And I really think that home grow is the only real option to control the costs and allow patients to get the amount of help that they need, and the access to raw cannabis like that. I really think that's the right step. I mean, I think it's great that we've been able to add the PTSD bill and to get more and more patients to have that access. But I think a full legalization and descheduling is the only right answer eventually, and it should be done tomorrow, in my opinion. But
Well, thank you, Tony. Our organization certainly agrees with you. We've endorsed legalization of marijuana, and we certainly support home grow. That really empowers patients to take control of their whatever medical condition that they have, and to produce their medicine for pennies. Really,
it would give me economic freedom. I wouldn't be rich, but I would be able to have my own medicine and have money in my pocket at the same time.
Right. And so that's very important, and it also does away with the fears of big marijuana. Some big corporation coming in and taking over the marijuana industry in New Jersey. If patients are allowed to grow, a limited amount of plants or anyone can grow a limited amount of plants, really, because right now what we have is a marijuana distribution system in New Jersey that is very much resembles prescription medicine. You have to go to your doctor every 30, 60, 90 days. How often do you go?
It's about 60.
About 60 days. Every 60 days you have to go back for a recommendation to go to this alternative treatment center to get a certain amount of this controlled substance.
Which costs $100. Just to go for that recommendation.
Your doctor charges you $100. Every 60 days another $100 tacked onto that. And it's just like going back to the doctor for a recommendation or a prescription for oxycodone every 60 days. Except
very similar.
Except that he doesn't write it on a prescription pad; he writes it on his letterhead or whatever.
Right.
And so that's. But if it were available, if marijuana were available for anyone in a liquor store or someplace where IDs were checked, it would be more like an over-the-counter drug. In addition to having the home cultivation option, just legalizing it through liquor stores or some other form like that.
Considering the safety and the toxicity of the plant, I don't see why it's not next to ginseng on the Whole Foods counter. No one's dying from it. It's safer than Tylenol. Why can't I buy it like Tylenol?
It is safer than Tylenol. The active ingredient in Tylenol, acetaminophen, is one of the leading causes of liver failure in the United States. So you're absolutely right, Tony.
And which ties right into the opiate addiction problem, where you have people that are eating Vicodin with Tylenol in it and destroying their livers.
Yep, absolutely. So thank you so much for coming here to Princeton Community TV Studio and telling your story, Tony. I'm very grateful for it.
Thank you very much for having me. Happy to be able to tell my story.
For more information about the Coalition for Medical Marijuana in New Jersey, join us at our free public meetings on the second Tuesday of every month at the Lawrence Township Library in Mercer County, New Jersey, from 7 to 9 p.m. Snacks are served and all are welcome. Remember, every 42 seconds, someone is arrested for marijuana.
Every 42 seconds, someone is arrested for marijuana.
Every 42 seconds, somebody's arrested for marijuana.
Every 42 seconds, someone is arrested for marijuana.
Every 42 seconds, someone's arrested for marijuana.
Every 42 seconds, someone is arrested for marijuana.
Every 42 seconds, somebody is arrested for marijuana.
Every 42 seconds,
Someone is arrested for marijuana.
Cada 42 segundos está uno arrestado por marihuana.
Every 42 seconds, somebody is arrested for.
Every 42 seconds, someone in this country is arrested for marijuana.
Chaque 42 secondes, il y a arrêté un monde pour marijuana.
Every 42 seconds, someone is arrested for marijuana.
Every 42 seconds, someone is arrested for marijuana.
Every 42 seconds, someone is arrested for marijuana. It could be you.
One, two, three, together, 1, 2, 3. Watch your feet, together, 1, 2, 3. Cha-cha-cha, they dance the cha-cha-cha. In New York, they love to cha-cha-cha. One, two, three, together, 1, 2, 3. Cha-cha-cha, I love to cha-cha-cha. 1, 2, 3, together, 1, 2, 3. Cha-cha-cha, I love to cha-cha-cha.